Hello, everybody. This is Dr. Kevin Connors, and we are on week, I don't know how many times we've done this, but many, many weeks, and we are on the 15th of February. Now, I'm recording this a few days later because that recording of the Zoom call that was live did not get recorded because of where I was at. The internet was slow. So I want to go over this again with the questions that people had. I can't remember everyone asked, but I do want to get these questions that people spoke about out and discuss these. So here's some questions that people sent in. What do you do with an overzealous immune system that is neither Th1 or Th2 dominant, but rather a mast cell mediated response, histamine intolerance, chemical allergies? There's a lot of information just in that question. I think that I need to explain that. So your immune system responds to a biotoxin by firing a Th1 response immediately. That's called your cell-mediated immune response. I got a picture of it here somewhere. That's also called your Th1 side. You can think of that as the Marine Corps of your immune system that is out to kill things. It's not to detox things. It's to kill something, an invader in your body. So it's meant to be expressed, not specifically to cause inflammation, though it does cause inflammation, but it's meant to be expressed because with it comes the maturation of T cells and killer cells, macrophages, in order to kill a bacteria or virus that's entered your body. Think of that as the Marine Corps or the police force that's going to be the immediate response of an antigen present in the form of a biotoxin, meaning a virus or bacteria or fungus or something like that that's entered your body. That's the Marine Corps that gets sent out to kill things. After about 24 to 72 hours, if that is unable to kill this, so if it's a really bad flu and it's unable to kill it, then your Th2 system or your B cells respond, or your humoral immunity. That is the side of the immune system that isn't out specifically to kill things, but out to create antibodies against that thing which the Th1 cells tried to kill. So the purpose of the Th2 response is mainly to produce antibodies. So think of that as a fluorescent tag that's going to go on those viruses that now when the Th1 side fires again, they can find it and kill it. Well, there is another response that this question is aimed at, and that response is, what if it's not a Th1, Th2 response that you're dealing with, but what's called a mast cell response? Now, mast cells are a different part of your immune cells that respond to different allergens specifically, and part of their response to allergens is to cause inflammation so that your body's lymph system can get that cleared out and get that allergen cleared out. Now, there is a syndrome that is becoming more and more research. It's called mast cell disease, where a person has an overzealous mast cell response to many things. Now, the reason why that exists, at least right now it's believed, is because we're exposed to so many different toxins. Our mast cells are just overloaded, and they can be like stuck in a turned on situation. So you have this constant mast cell response. Now, what mast cells release is a chemical called histamine. Histamine is pro-inflammatory. It's to help clean up an area, but histamine is very inflammatory. So if I have this constant histamine release, I'm going to have all these symptoms of a constant histamine release, which is going to be pain and other things as well. So itchy skin, inflammation, some acute inflammation, psoriasis, just this constant chemical sensitivity. And an over response to chemicals in our environment, as compared to maybe my brother or sister or friend or somebody like that. Maybe it's not really an over response. It's because we got so many chemicals in our environment. Well, then that's exactly what this person is alluding to in their question, because they say, you already have us detoxing with so many different things. Is there other ways to detox, or is the statement true, you're doing the best you can do? Well, that is true. There is a limit to what you could possibly do as far as detoxification. If you're going to spend your entire day, all you're going to be doing is detoxing, well, that's not such a good idea either. We have a greater purpose than just to be constantly focused on ourselves and focused on this immune system response. And if the more we're focused on an immune system response like that, you do have that brain cell connection that the more I'm focused on something, the more it happens as well. So we don't want to tip over to that side of the pendulum either. So there are some nutrients that can be beneficial if someone is in a mast cell dominance where they got this constant flare-up of mast cells. There's a product called histamine scavenger. There's a number of companies that use some type of histamine scavenger that can be beneficial. Quercetin, curcumin, boswellia, different anti-inflammatories can be beneficial there. We're experimenting using more of the DAO enzyme itself. So let's take a step back a little bit. You have certain genes in your body. The ABP1 gene family in your gut is largely responsible for making a specific enzyme called the DAO enzyme. The DAO enzyme is responsible for breaking down histamine in foods that we eat. Now, it's not just, I believe that it's not just responsible for breaking down histamine in the foods that we eat, but it's breaking down histamine in the gut that, that of other foods that we eat that maybe don't have any histamine, but we're getting a histamine response because of those foods. Meaning, let's say I'm eating some gluten that gluten doesn't have any histamine in it, but gluten is causing an inflammatory response in my gut. Well, taking a DAO enzyme with my food can be extremely beneficial to decrease that inflammation and decrease the histamine that's being produced because of gluten or dairy or something else in my diet that is so inflammatory, or even GMOs in my diet that are anything that's inflammatory in my diet is going to create histamine production in my gut. And if I don't have adequate DAO enzyme in my gut to break down that histamine, I will absorb it, and that will contribute to what I believe is an overabundant mast cell production. But in some of these cases, it may not be so much an overabundant mast cell production. There may be some of that going on, but it's an overabsorption of histamines in the gut because of inflammation in the gut that's not being tamed because of ABP1 gene defects. Now, there's another gene called your HNMT gene that makes the DAO enzyme in the tissue, and it's currently not believed that if I take DAO enzyme orally that I will absorb it, that it's really working solely in the gut. But we've done some experiments that of just increasing the DAO enzyme in a person's body taken between meals and with meals decreases that histamine response systemically considerably. And I think the mechanism of that is that it's decreasing the inflammation in the gut, which is decreasing the inflammation systemically. Because you remember, any inflammation in the gut is going to cause inflammation in the brain, which is going to cause inflammation in the body. So that is something you may want to consider if you feel like you're just hyper inflamed all the time and you're overreacting to everything in the environment, is taking a DAO enzyme product. We have several in our store. Taking a DAO enzyme product with meals and between meals to decrease that inflammation in the gut. The third question kind of alludes to that same thing. What do you do to try to avoid toxins in your environment? Use air filters, water filters, everything. Yeah, it is very true. You do the best that you can. It's going to partly depend upon, how much money you have to buy air filters and water filters and such, but you have to live in your environment. And I would really suggest you try some nutritional things, look at other dietary things, maybe some other foods that you may be sensitive to that maybe don't have any histamine in it, but are causing some inflammation. Staying away from GMO foods. just doing the best and trying to put your mind off of it as much as possible, because that certainly doesn't help. So it's all about detoxing. So switching gears, we have some other questions about the IvyGene test. One was, if my IvyGene test is below 20, how often should I do the test? If you don't know what the IvyGene test, you have to go back and watch those videos. And you don't know what the IvyGene test score is, watch those 2 videos that I created on the IvyGene test. They're on the Facebook page if you're a patient, and they're also on our YouTube page. So you can look up Connor's Clinic on YouTube and you'll find the IvyGene test. The IvyGene test, again, is a test for cancer, and it is a quantitative test for cancer, meaning if I might have a cancer diagnosis, but my IvyGene score is coming at back at a 19, then I'm doing well with my cancer. It doesn't mean I couldn't do better, but I'm doing well with my cancer. My IvyGene score is coming back at an 8. I'm doing fantastic with my cancer. My cancer is basically in remission. So that's how beneficial the IvyGene test is. So if my score is below 20, how often should I do the test? I can't answer that question, because your cancer, I have seen patients go, oh, I'm doing so well, prior to the IvyGene test. Over the 20 years I've been taking care of cancer patients, I'm doing so well, I just stopped using the Rife. I just stopped taking my supplements because I was doing so well. And in 3 months, they were dead. So cancer can undulate like a pendulum. And once you go into basically a state of remission, meaning the cancer is just quieted down and it's not growing, don't get fooled. How many people go and the standard of medical care and do that, and the doctor says, oh, you're cancer free, and 2 years later they're dead, because it, quote unquote, came back with a vengeance. Well, the truth is it was never gone. So don't stop doing the things that put you into remission. I've had people call me, my patients, and go, can I stop taking this product? I'm doing so great. Look at my cancer markers are down back to normal, and I'm just sick of taking this, and it's expensive. Well, do what you want to do at your own risk. I can't tell you that. I don't have a crystal ball that's going to say if you stop taking this, your cancer is going to come back. I'm not trying to tell you that. All I'm saying is be wise and go, okay, if whatever I did got me to where I want to be, maybe it's a good idea to not stop doing what I did. So you're going to have to come to that conclusion yourself. Is it best to take the test once a month? Well, that can get costly. Once every 3 months, that seems reasonable. So use reasonableness in that. Maybe even help make the decision through your symptoms. If you're feeling fantastic and you felt horrible before and now you're still feeling fantastic, maybe you could put it off another month. So that's only a question that you can answer. There is no set answer for that. Just think through those things. How often do I want to see a patient if their IvyGene test was below 20? Same thing. So same answer for that question. You're going to have to make that decision yourself. It'd be best to see a person every month, but I know most of our patients aren't even from around here. So everybody's going to have to make their own decision. I've always said that, one of the best ways you can kind of tell where your cancer is, well, how are you feeling? How's your energy levels? How's your, if you have a symptom that you can go off of, that's a pretty good telltale sign. No test, including a CT scan or a PET scan or an IvyGene test or anything else, is going to be perfect. I've had people go, oh my gosh, I did a PET scan and it came back clean. Yay, I'm cancer free. It was wrong. It's not perfect all the time. Just because it's the gold standard in medical care does not mean it's perfect. And any honest doctor will tell you that same thing. There is no perfect test. You have to balance it between things like an IvyGene test, an ultrasound, a PET scan, a CT scan, and how am I feeling? When I started this journey, I was falling asleep at 3 o'clock. I had no energy. I looked ashen. Now I got my color back. I feel better. You know, I'm not back when I was 20 again, but I feel much better, more like I should probably at my age. That's a really good sign. So those are the things that you kind of want to look at. All right, so that is it. I can't remember all the questions you guys had last week that we covered, but I just want to keep encouraging you, and I'll get this up on Facebook.